Welcome to our Afluencer podcast. This is our first one where we've got someone representing not only a brand, but also a movement. We've got Wendy Post here, founder of the Birthmark brand and mission, committed to the advocacy, support, and education of birthing rights. Wendy, welcome. As I mentioned at the outset, love the shirt. Thanks for joining us. Can you give us a little background about yourself and what brought you to this point of founding the Birthmark?
Sure. So my journey in the field of nursing really started 23 years ago. Most people don't realize this, but I'm a labor and delivery nurse. I was just passionate about helping moms and their newborns, making sure everybody got the best care that they could. But like many journeys, there are moments that really shake us to our core. And so early in my career, I witnessed a maternal death, and the patient was my very age. It was profound, it was traumatic, and it led me to take a detour. So I left labor and delivery and went to ER, hoping that I'd come to terms with it. And I came to realize that it wasn't about running from the trauma, but channeling it into something that could be transformative. And so it birthed the Birthmark in me, and really a company that's entirely dedicated to championing maternal health rights, the outcomes of moms and their advocacy. So it's my tribute and commitment to ensure that moms get the best care they can. And so we have three branches. We have a foundation, we have an academy for education, and then we have a for-profit for products.
That's awesome. That's awesome, Wendy. Yeah, thank you for the story and background. It took me back. I've been in the delivery room twice, and the first time was, I could only imagine what you went through, because we had a moment where they says, "Dad, sit down, everything's okay," and all of a sudden there's 9 nurses in the room. And everything ended up being okay, fortunately. But it's scary moments, right? Touch and go, where there's so many moving parts to the whole
delivery process. When it happens fast, right?
Yeah.
You could be fine, and then in a moment's notice, that changes. That conversation completely changes. And so
yeah.
People really should be prepared for that.
Right. And I think it's as a woman, you're more, you see the long view, the whole 9-month process. As men, we're asleep until the day of or the day before. We're just not wired that way. But then it does happen fast. We had a long, 33-hour process, but then all of a sudden you're like, right, it all kind of comes together at once, I guess, so to speak. So what, talk about the Birthmark, Wendy, the goal, vision that you had for it. How long have you been thinking about this? Because I know you've had your 23-year nursing career. Is that right? So, long time. So how long has this been formulating in your head, and what were the steps you took to get moving towards the Birthmark?
Without specifically giving my age, I can tell you that it's been 15 years plus in the making.
We'll need to see ID for that. I'm not sure, to verify.
Definitely nearing that 20-year mark, where you don't want to believe that it's true. You hear the stories, right? You go to the barbecues, you talk to family and friends, and you don't want to believe that these are the realities that are happening in the hospital, but they are. And so you're really trying to grapple with, how do you rectify that, and how do you make a difference? And I thought by going to the hospital that I would. And I really quickly realized that it's really going to be the community grassroots effort that's going to make the difference. So that's what really birthed it. The goal and vision is really to bring to light the disparities and the challenges that we've kind of highlighted, ensuring that all moms, irrespective of anything, background, financial ability to pay, disability, whatever it may be, that they have equal access to care, and that care is quality driven, and that it's rooted in patient safety, that they have informed consent, that they have education, that their rights are supported and advocated. And that's really the vision. That's what we're about, a world where maternal health care is prioritized, where a birth story is celebrated and tragedies are a thing of the past.
Yeah, do you feel that maternal health in general is buried a bit in the conversation, or not given the attention that it should be? Should just be more talked about in general, as you said, and really celebrated?
I think that maternal health should be more discussed and prioritized in a global conversation, because it's not just about the well-being of a mom. It's the fundamental health to families, to communities, and to societies at large. It's a human rights issue, right? So every mom has the right to a safe and a respectful birth, but disparities still happen. So highlighting the pressing need for attention is definitely paramount. It's a public health indicator. So the status often serves as a litmus test for the overall healthcare of our country's infrastructure. Morbidity and mortality rates are going up, they're not going down. And so policy needs to intersect that. There's economic implications. When moms are healthy, they contribute more effectively to their families and their economy. But on the other hand, when a mom has complications, this leads to long-term health costs, and it also reduces their productivity to society. There's some intergenerational impact. So healthy moms that give birth to healthy children set the stage for healthier generations. But moms that have complications have ripple effects, and that affects their children and their future. So it's broader than birth. It's not just about the act of childbirth. It's really preconception, prenatal, postnatal, mental health, nutrition, and education.
Makes sense. As you were going through that, I thought about just the state of the healthcare, health in general in our country today, right? It's all focused on after something bad happens. We tend to be pretty good at acute care and really not good at all at preventative type of anything. And that goes, like you said, beyond the maternal health and the birthing process. But this is just in general. I mean, we don't tend to go to our doctors to get, productive preventative health advice, right? And that's kind of across the board. So it's great that you're bringing this to the forefront, especially on the maternal health side. What large misconceptions do you see today in maternal health that you see often and that you could share and that we, should really bring to light?
That it's only about childbirth. A lot of people believe that it's just the act of giving birth, but like we said, in reality, it's preconception, prenatal, and postnatal. And it's that holistic view, the mental health of mom, the emotional and physical well-being of a mother. It extends so far beyond just the delivery room. And that modern medicine has eliminated risk, right? In 2023, nearing 24, I can't believe I'm saying that, medical advancements have reduced mortality and morbidity, but they still exist. And no childbirth is without risk, irrespective of where and when it takes place. And that's a reality that we come to grips with in labor and delivery daily. Mental health is secondary. I think that's one of the greatest misnomers that I hear. There's often an overwhelming focus on the physical side, and we're sidelining the mental well-being. Postpartum depression, anxiety, and other mental health conditions really affect moms, and they deserve just as much attention as the physical ailment does, especially post-COVID. You're seeing a lot of moms that have been traumatized from losing family members and friends, or maybe even being affected multiple times or infected in pregnancy. So there's a trauma-related effect to that. All maternal care is equal, and that's not true. Unfortunately, all care is not equal care. Some groups really face higher and lower quality care due to systemic biases and resource limitations. Maternal care only belongs to us as women. It's our responsibility. We birth, so we need to handle it. And that's far from the truth. Maternal health impacts everybody: partners, families, communities, societies. It's a collective responsibility to ensure that everybody gets safe maternal care. And then that education equals preparedness. Just because a woman is well educated, that doesn't necessarily mean that she's fully prepared for childbirth or the challenges that childbirth will bring her. So every woman, regardless of her education, her financial background, she deserves equal support and education in maternal health.
Love that you brought it to the forefront with the birthmark and realizing that when you're in the healthcare sector, you're limited in terms of the types of advocacy you can do. And now you're in control of your own destiny. You've got this company, you got these products, your brand, influencers you work with, and we'll talk about that in a moment, where you can really spread the message here. And then also you're in control of your own everything, which is awesome. So let's talk about the birthmark. As we mentioned, company dedicated to women's rights, reproductive justice, and health advocacy, health education, especially on the maternal health side. What types of products are you producing? What types of products are you selling with the birthmark currently?
So we have a birthing box. There are 12 different types of boxes. So it can be somebody who was a surrogate or an adoptive mom. It can be a mom who may have need for support, wasn't expecting to get pregnant, got pregnant, and just really needs a lot of items to get her started. And it might be a postpartum mom or a mom that has preeclampsia or diabetes. So we have a curated line that's dedicated to mostly everything you can experience in pregnancy. It is ethnically considered. So depending on which mom or which artist prototype you most relate to, you can buy a box that has everything for the need to start from pregnancy to the end. So there, for example, if you have preeclampsia, we have a preeclampsia box with a specific education book that tells you how to check your blood pressure, how to dip your urine if there's protein present, how to communicate with your doctor and what to look for. What are the signs and symptoms? And if it's getting worse, how do you know you're getting into something called HELP syndrome? So we really get into the need of education, but also being able to be your own champion and having your family and support people be able to help you through. So that's part of the products. We also have breast pumps. So we have a lactation box that comes with a wireless breast pump. So moms have a hand-free experience when they're trying to pump or nurse for their baby. So there's a whole curated line that's just dedicated to maternal health.
That's great. And how are you marketing the product line today? I can see there's, when you're describing it, there's lots to it. So it lends itself to, I don't want to say maybe, storytelling or just kind of sharing, right? Where we want to have kind of longer form where we can hear what you're offering here. So how are you currently marketing? Is this a social media base?
We try through social media. We do go to pop-ups. The e-commerce is pretty steadfast. We use your influencers, right? We have influencers that do reviews of our products and tell us what they think about those products and make recommendations on how we can improve. And then we do a lot of giveaways. We want actual moms to review our products and tell us what they think, how we can improve or change. And we also just provide customer feedback. We do not script. We want to know exactly how those influencers feel, how the customers feel, and we take every piece of comment, recommendation, and even some of the constructive criticism to heart and make those changes to impact our communities.
That's awesome. Is this your first company, Wendy? It feels like it's your fifth or sixth.
It's my second. My first one wasn't very successul, but it taught me so many lessons that I think it prepared me for this one.
I was going to say, I mean, I know you've been in the nursing world but it feels like you've done this before from a customer feedback standpoint. This is great. On the influencer side, I do have your collab up and we'll get a link under this in the show notes so our influencers can apply. And I see we're looking for specifically the mom, parenting, baby health focused influencers to help again with the product feedback, reviews, spreading the word. Wendy, can you tell us what types of influencers and creators and micro influencers specifically you're looking to work with today?
Sure. I actually would love to have some male influencers. I want to hear the father's voice. I'd like to hear from aunts and uncles and people who've been to the bedside, who've supported moms and who have a different eyewitness perspective. So it's really any influencer that aligns with our mission and our values at the Birthmark and are really passionate about advocating for maternal child health. They're always welcome to collaborate with us. We believe in creating meaningful partnerships that really resonate with our brand's ethos and the influencer's audience. So if they wanted to reach out to us or work with us, the best way to reach us is by email. We can be reached at hello@thebirthmark.net. And we review every inquiry and we make it a priority to respond within 24 hours.
Well, that's great. Thank you, Wendy. Shout out to my fellow dad influencers out there. Well, my fellow dads out there, but our dad influencers. This is a great collab to take a look at the Birthmark. As well as Wendy said, you can email her. We'll have the link again so you can apply to the collab. We'll get your application over to Wendy for review as well. This has been great. I really enjoyed the chat, Wendy. Before I let you go, how can our viewers, readers, users, everyone get a hold of you, follow you, and stay tuned to the Birthmark?
Sure. So we're on Instagram. Our handle is @_the _birth_mark. We also have a pretty strong website at www.thebirthmark.net. And again, we can be reached by email at hello@thebirthmark.net.
I like your website a lot, by the way. Yeah, it's very nicely designed. It's a beautiful website. So we'll get the link to the birthmark. We'll get the Instagram link. We'll get all this good stuff.
Thank you. Each of the women that you see is a real story. So they actually were birthing women throughout the 23 years of experience. These are each women that we created that really existed. So.
Oh, is that right? Where are they on the site? Is that on the blog here?
They're all over the site. So all of the artist sketches that you see are actual patients that we've cared for over the years.
Oh, that's awesome. Oh, wow. Okay. Yeah, I see. Okay, cool. That's great. All right. Birthmark.net. We'll get the link to the site up. Thanks again, Wendy. Been really great talking with you.
Brett. This has been amazing. Thank you so much.
Great. Thank you.